Hello guys, so today we are going to talk about choosing your light curing device, which makes a lot of difference for the success of your restorations and even cementation procedures, okay? So we know that there are several brands, there are simple ones, and then the prices are usually cheaper, but then we have others with focus tools to focus the light on smaller areas. We have also diagnostic tools in other devices like this one, the VALO, and then other more simple ones, just like this one that I used, for example, in my clinic. But this was in the past, and now I use the VALO X from Ultradent, and I'm going to explain why this is the best choice nowadays. This is the button to turn on, but then we have another button at the back activating the diagnostic tools, and we are going to talk about those. They are really useful. So this is the device, and then if I want, I just put the device on the table, and then if I want to reactivate, I just lift the device like this, and then the device is activated by itself, which is amazing in the clinical routine. Now if I do this drum tap move, like forward move mid-air, then I activate the extra power mode. And after rotating the device and doing the same move, then I have the diagnostic tool mode. So I have the white light I can use for diagnosis, and then the black light. And those two I can use to perform transilumination examination, for example, to detect fractures. And then I can always go back to the white light, and the white light I can also use for selecting the colors of the patient and other usefulness like this. Now there are the tips. This is the interproximal tip, and the tips adapt really nicely, okay? Now activating the diagnostic mode for the white light again, and then I can see for interproximal caries, for example, right? This is another tip, very useful as well, and take a look at this. I'm showing you through the protection, the orange protection, but then you are seeing that interproximal caries can be detected like fractures. Why? Because the light will pass through the tooth, and then fractures or cracks will be identified. So this is a very useful diagnostic tool that you have. So just showing you again in a clinical video. And then there are many ways that you can do the transillumination examination. I'm not going to go in details. I am recommending a reference here for you guys. But the fact is that when you throw the light on the teeth, then you are able to detect fractures, interproximal caries, and so on. Okay. Now let's see the interproximal tip. Of course, it's not being used in the interproximal context. Now it is, so we are moving the tip to detect interproximal caries in the context. But of course, as you guys can expect, it's even more useful for molars, okay? You fit the tip in between the molars, and then you can detect alterations on the crowns. So that's why I think this is the best choice.